Hi there, I'm Abby, the Data and Information Lead at WCMICS. I'm here to talk to you about the impact of COVID-19 on cancer care in Victorian health services. Let's get started. WCMICS is short for the Western and Central Melbourne Integrated Cancer Service. We are one of 9 integrated cancer services located across Victoria with 8 adult services and 1 statewide paediatric service. We are Victoria's Cancer Services Improvement Network. Our goal is to build relationships between healthcare providers and other cancer stakeholders to develop, implement and evaluate initiatives that improve the way that Victoria's health services provide care and support to all Victorians affected by cancer. During this presentation, we'll start by looking at Australia-wide statistics to understand the impact of COVID-19 on our society. We'll then focus in on Victoria and look at the impact of cancer care across the state. This is Tina. Tina lives in Melbourne's inner north and lost her job in the events industry at the beginning of the pandemic. It's August 2020 and Tina's been in lockdown for weeks with no end in sight. Research tells us that 1 in 5 Australians are reporting high or very high levels of psychological distress linked to the COVID-19 pandemic, with young people, women and those living with a disability the most affected by poor mental health. A survey released in June 2021 by the Australian Bureau of Statistics also reveals that the outbreaks in Victoria this year have led to a surge in psychological distress, with almost a third of people in the state reporting feelings associated with depression and anxiety compared with 18% in the rest of Australia. Along with changes to our home life, we've also seen impacts in unexpected places like supermarkets. In 2020, at the beginning of the pandemic, research from the Australian Bureau of Statistics found that compared to 2019, spending increased significantly for both perishable and non-perishable goods across Australia. As a result of panic buying, supermarket spending saw a rise in annual revenue of 37.7% for non-perishable goods and 20.2% for perishable goods. But one of the biggest challenges we've seen, which is especially important to us here at WCMICS, is the impact of COVID-19 on cancer within Victorian health services. The COVID-19 pandemic disrupted cancer care, including delaying diagnosis and treatment and halting clinical trials. Despite cancer-related services classified as vital and remaining available, utilisation reportedly dropped due to patient reluctance to access services. Based on reduced notifications, the Victoria Cancer Registry estimate that 2,530 cancer diagnoses were either delayed or missed during the most severe lockdown period between April and October 2020. Based on findings from the Victorian Cancer Registry, anecdotal evidence and conversations with stakeholders across health service providers, we started to ask the question, how has COVID-19 impacted cancer care services across Victoria? By asking this question, our aim was to examine inpatient activity to see if any trends could be identified. By performing this analysis and identifying any outliers, this information could be provided back to health services in our catchment area to help inform service provision and planning. Using data from the Victorian Admitted Episode dataset, the data team analysed activity across Victorian health services to understand if there was a change in number of admissions and patients between 2019 and 2020. Let's explore this further. During the year 2020, 84 cancer patients were diagnosed with COVID-19 across Victoria. Of these patients, 86.9 were treated at a public metropolitan health service and 13.1 were treated at either a regional health service or a private health service. Between 2019 and 2020, we found a 6.1% decrease in the total number of admissions and a 10% decrease in the number of cancer patients seen throughout the year. When we look at this more closely, we can see the activity decreased during level 4 lockdown periods, with decline peaking in May at -22.5% and August at -17.6%. We're now going to explore the impact on tumour streams in more detail. Our analysis shows us that the largest drop in new patients across Victorian health services was in skin cancer, colorectal and rare cancers. Alongside this, we reviewed the data to see if any tumour streams had an increase in new patients during the year 2020. We found that only CNS and lung cancer saw a slight increase. All of the tumour streams showed an average decrease of 9.4%. When we look at this more closely in 6-monthly intervals, from the beginning of 2019 to the end of 2020, we can see there was a steady decline in the total number of new patients across almost all tumour streams. The next area we looked at was inpatient procedures. 2020 saw a significant decline in the number of procedures performed. Compared to 2019, the procedures with the highest drops were scopes, surgical procedures and biopsies. The only procedures that saw an increase were chemotherapy by 6.3% and blood products and allied health both by 2.9%. Finally, we drilled down to allied health interventions to understand if there was any significant impacts. We found that interventions such as biomechanical assessments, music therapy and physiotherapy saw a decrease, whereas interventions such as diabetes education, prosthetics and orthotics and speech pathology saw an increase. In summary, we've seen that COVID-19 had a significant impact on cancer care in health services across Victoria. From 2019 to 2020, there was a decrease in the number of patients and admissions, with the most significant drops in activity seen in May and August 2020 during stage 4 lockdown periods. We also found that certain tumour streams and procedures were more impacted than others. For example, skin cancer, colorectal cancer and rare cancers saw a decrease, as did biomechanical assessments, music therapy and physiotherapy procedures. Our aim going forward is to gather information on inpatient activity for 2021 to see how trends have been affected after 12 months of COVID-19 in Victoria. This will allow us to see if there were any spikes in activity as a result of surge capacity, and also understand if the 2021 lockdown periods to date correlate with a drop in activity as they did last year. Thanks for joining me today while we explore the impacts of COVID-19 on cancer care in Victorian health services. If you have any questions, feel free to join me during the Q&A session.